Hey, folks, welcome to another Leading in the Moment podcast. I'm your host, Chris Coraggio. This podcast is designed to give out information of community efforts as we all sort of navigate our way through this COVID-19 pandemic. And joining us today is Dr. Susan Wilder. She is the CEO and founder of Lifescape Premier, her practice. And Doctor, thank you so much for being here, taking some time out.
Thank you for having me. Appreciate
You got it. Okay. We want to talk to you about a couple of things. First, let's start with a term that most people are starting to really be aware of. Not social distancing, that's the main one, but telemedicine. Talk about that in a general sense and also as it pertains to Lifescape.
So telemedicine is just the ability to access medical care virtually. So whether it's through a phone, through a video conferencing option such as this, or even FaceTime, through email potentially. And it's been a little limited in the country because of licensing requirements, but Lifescape's engaged in telemedicine really since our very beginning. We have what's called a direct primary care practice, where we take care of a smaller group of patients who have, the majority have direct access to their provider 24/7, 365 days a year. And then we also have a lower cost direct primary care option where people have unlimited access to telemedicine visits with their designated provider. There's lots of telemedicine out there too that's just an anonymous provider where you can call a 1-800 number and get some provider somewhere who can give medical advice. And there's pros and cons and limitations to all options.
How much of an increase have you seen at your practice, and maybe just what you've gathered in the overall medical community, maybe over the last month, when it comes to telemedicine appointments?
Well, because most practices have really had to, do the same thing that everybody has to be doing, which is shelter in place as much as possible and limit our exposures to limit the spread of this virus. Every practice is either adopting to telemedicine or probably closing. It's very difficult to do everything by telemedicine. There are certainly certain things that require examining a patient. We're very fortunate because our patients are used to this. This is a standard operating procedure. We always take care of everything we could do virtually. There's no reason for a patient to come in for a visit if it's something that we could handle over the phone. But we also have the benefit of really knowing our patients extraordinarily well. And, so that's a different experience than maybe some of these anonymous 1-800 type options for telemedicine where they don't have any really basic knowledge of the patient. It's a totally different ballgame.
Definitely. And like you said, just the convenience of 24/7, having the ability to contact with a doctor, especially in this time when you may think you may have symptoms, and then you can kind of talk your way through the appointment and have the doctor evaluate you in that regard, correct?
Absolutely, yeah. We do everything possible to keep patients out of the hospital, out of emergency rooms. We might be texting all night with a college student who's freaking out with some symptoms that they're having off, who knows where. And fortunately, the legal limitations around telemedicine have been relaxed significantly because of this. We've been arguing for years that medical licensure effectively should be national. That it is crazy for me to be basically exceeding my license when I'm taking care of my own patient who happens to be in Minnesota for the summer, or Canada, or London, Japan, you name it. Effectively, the practice of medicine ought to be a nationalized process, I believe.
Well, that's sort of maybe a silver lining that's going to come out of all this, the loosening of the reins, if you will, through telemedicine. Let's look for another silver lining and something that you've been seeing. I know some of your patients are suffering from depression. Can you talk a little bit about what you've noticed or what you've gathered during this maybe stay at home, shelter in place time that we're all living through, when it comes to the patients with depression, what they're experiencing in this quarantine time, if you will?
Yeah, it's really been fascinating. We've been actually actively outreaching to all of our patients, and particularly those who are alone, who we know are kind of, our senior patients who are virtually captive in their apartments, and to those who have anxiety and depression. And one of the things I found almost uniformly is that this artificial pause button that this virus has hit on us socially and forced us to step back from these overly frenzied, overscheduled lives, kind of the clamor for attention, and I think has been really positive, and it's forced people to, number one, pay attention and really focus on what's truly important. And number two, something we always really focus on is really treasuring your health. Most of us don't treasure our health till it fails. And this is an opportunity to say, whoa, you know what? We're at war. And my number one duty in that war is to stay healthy or get healthy. We look at the American public, most of us are not eating as much as we should. Most of us are eating very poorly, drinking too much, etc., not managing stress well. And 88% have metabolic problems, diabetic, blood sugar issues that are going to put them at high risk of this virus. Well, this is a wake-up call that I think has a tremendous silver lining, and hopefully it's another thing that will stick, that we will learn how to treasure our health and be better stewards of it.
Yeah, I was going to ask you how optimistic are you that it will be sustainable once we're kind of through this?
Oh gosh, the only certainty about this is a lot of things will change, and it brings out, every crisis brings out the best of humanity and the worst, and I think it's our choice to determine how much we actually, focus in and learn how and decide what we're going to do differently. I heard a quote recently that said, what choices are you willing to make, and what are you willing to give up to have the life you're pretending to want?
Yeah.
We find all the time four simple pillars. If people attend to sleep, if they attend to a healthy plant-based whole food diet and get off the refined and processed stuff, if they exercise every single day, which is a better antidepressant than any medication out there, and they attend to some form of stress management, prayer, meditation, deep breathing. Now, I've found it takes 3 deep breaths to wash my hands for 30 seconds. There's a mini that's really easy to adopt and get stuck on. But when people do that, hey, they don't need hormone pellets and replacements. They don't need antidepressants. They don't need a lot of the things that we band-aid our symptoms with, because they got the roots.
Doctor, what's the website of the practice?
Lifescapepremier.com, and we're on Facebook, also Lifescape Premier, or people can join our Brilliant Health community. We have a COVID frequently asked questions Facebook Live every Friday morning at 10:30 Arizona time. And we're doing Healthy Kitchens classes virtually every month. And so lots of fun things and lots of very easy ways for people to learn how to treasure their health. And it's the same things that boost your immune system.
Well, Dr. Wilder, you're certainly leading in the moment, obviously, listening to you during this podcast. So we appreciate that. We appreciate all the knowledge in this podcast, and stay healthy. And thanks for being here.
Thank you. Appreciate it.
You got it.